Hi, I'm Jeremiah Miranda. I'm a student physical therapist assistant from South University. Today I'm going to be demonstrating workouts specifically on the topic of sitting with perturbations. I'm with my sister here, which is our mock patient, Dre Miranda. And before I get started, I'd like to let you know that this video is for educational purposes only, and that South University and yourself does not assume any responsibility or liability for any injuries incurred outside of the use of this project. Please perform at your own risk. So, getting on to the topics of sitting with perturbations, the purpose of this workout is an advanced stabilization workout. We're going to be working out the lumbar spine, your back extensors, and your back flexors. So specifically, you're going to be working on that transverse abdominis, rectus abdominis, getting some of those obliques in there, and also your your posterior muscles, which is your multifidus or your rector spinae. And perturbations, the definition of that is specifically any movement deviated from a path. So there's going to be a lot of external factors and unstable surfaces that the patient's going to be working on that forces those muscles to be used. So we're going to go ahead and get started with the first exercise. So before I start these workouts as well, we're supposed to do all these workouts on an unstable surface, and sadly I could not check out any equipment or buy any equipment due to all this coronavirus thing. So I'm going to be demonstrating it on a regular seated chair. Please act as if this is an unstable surface on a Bosu ball or specifically a Swiss ball, and we're going to. So patient diagnoses for patients that have to do these workouts or normally given these workouts are for low back pain, whether it be their upper cross syndrome with their head forward and their lumbar spine constantly being stressed out. Maybe they have just poor body mechanics when they're lifting. Maybe they had a surgery on their lower back and they had a laminectomy and they're just getting out of that moderate protection phase. Or maybe they're pregnant and have complaint of low back pain. As physical therapists, we come in, we're here to educate the patient on proper posturing to help prevent that injury, to help strengthen those muscles, and decrease that pain by strengthening those muscles as well. So we're going to go right into it. Alright, so moving on to the phases of rehab, I consider this an advanced stabilization and balance workout, which forces you to use the muscles that I stated as previous. So you wouldn't want to be doing this with a max protection phase, obviously. If they have more pain and less range of motion, you wouldn't want these patients to do these advanced workouts to interrupt their healing process, to increase their pain because the workout's too hard for them during their healing process. So I would only use this if you're leaving the moderate phase and moving on to the minimal phase. So late moderate protection phase, moving on to the minimal protection phase. Okay, so warm-ups, I would, prior to our treatment or main workout, I have my patient walk for about 5 minutes on the treadmill, and then we're going to go ahead and start with our actual workouts. So the first workout is going to be isometric seated rotations. Seated rotations with a resistance band. So Andrea, what you're going to do is you're going to have your hands up, levels with your shoulders straight out. Alright, I want you to keep this stable and glued to the floor. And what I want you to do is you're just going to stay here, and I'm going to apply resistance to the band going this way. And I don't want you to move, okay? Keep that core engaged. Make sure you keep breathing, and we're going to go ahead and do this. So I'm going to keep it level with our hands, and I'm going to apply resistance. Is this okay? Is it too easy? It's too easy? Is this okay? Alright, so we're going to do this for about 10 seconds. After that, we're going to repeat this 10 times. We're going to do 2 sets. And when you're at home, you could anchor this. And you could do this, I want you to do this once a day, 7 times a week, okay? Alright, good job. Alright, now if I wanted to advance that workout, instead of using an isometric contraction, we could use concentric and eccentric. And again, we're going to be using the same muscles as I stated before, including the arms, using the transverse abdominis muscles, the obliques, and the posterior back muscles. and then isometrically with our arms, including our deltoids, biceps, triceps, finger flexors, all that good stuff. So next, moving on to that advanced treatment, you're going to start off in a seated twisted rotation, and then you're going to bring it back to as you were in the beginning, and then you're going to come back again. I'm going to be applying tension the entire time. Make sure to keep your feet stable and your core engaged, and make sure to breathe as well, all right? Make sure your movements are slow and controlled, and let's go ahead and get started, okay? Go ahead. Nice. All right, have your arms extended out even more. Perfect. Nice. Are you breathing? Good. All right. Relax. For our sets and reps, we do this about 10 times. For our sets, we do 2 times, once a day, 7 times a week. Moving on to our last workout for sitting with perturbations. This is more for like a functional task, or just testing out their reaction and balance while in their perturbation. So you could add this you could make this a plyometric exercise with a weighted ball, but we're just going to use a regular ball toss, okay? So, actually, can you turn this way? So we can just get the camera facing. Back up a bit more. Alright, so I'm going to just regularly toss the ball to the patient. They're going to catch and toss it back. This is again testing their balance because they're on an unstable surface. They're going to be testing their reaction time. I could throw it on the side of the patient, on either side, and they're going to have to reach and react to where that ball is going and toss it back. See how I could have her twist facing me, and we could get more mobility in that spine. Okay, so we do this about 10 times with the catches and throws. We would do 2 sets, once a day, 7 times a week. Thank you.